usually think of heart disease in adults, but congenital heart disease is also fairly common in children. 6 News anchor Lori Tucker has much more in tonight's Caring for Our Kids. Lori?
Thank you, Kristen. You know, if undetected heart defects in children can be serious, sometimes life-threatening. Heart defects occur before birth while the fetus is still developing, and those affect about 1 in every 100 children. Joining us now from Children's Hospital is cardiologist Dr. Jeff Jennings. I'm going to let you answer the question. I'm going to fix my microphone here. What are some signs and symptoms of congenital heart disease in children?
Well, some of the things you might look for in a baby would be breathing fast, difficulty feeding, perhaps not gaining weight well. In an older child, perhaps difficulty keeping up with exercise.
Things you notice as a parent, that they're just not keeping up with other kids and something's not quite right. You know, how is it diagnosed? What do? We bring our child to you. How do you determine what it is?
Exam is helpful. A lot of kids get sent to the cardiologist because of a heart murmur. And many murmurs, actually most murmurs, are innocent murmurs, but we're trained to sort of glean out the ones that are not. Echo or ultrasound is extremely helpful, non-invasive, quick, non-painful. So
good. So it doesn't put the child through too much. And you said, and do most kids grow out of a heart murmur?
Most murmurs are innocent murmurs, so they'll go away eventually.
That's good news.
And we can even do ultrasound or fetal echo on the unborn baby, so we detect a lot of serious heart defects before anybody knows they're there.
And get them treated really early on.
That way we can get them supported with what they need as soon as they're born, and they don't run the risk of going home not knowing they have a heart problem. Now,
say we have moms out there, you're pregnant right now. How do you know? Do you ask for something like this, for an echo?
If you have a family history of congenital heart disease, if the mom has a heart defect herself, or if she's had a child previously that had a heart defect, then she should have a fetal echocardiogram.
All right, Dr. Jennings, thank you so much. We've run out of time. We wanted to talk about Project Adam. We want to thank you so much for your work in that. We'll get to that at another time, but that is where the AEDs are in the schools now. They've graduated, if you will, on up to the high school, so we thank you for your participation and your leadership in that. If you have a question about your child's health, just email me at ltucker@wate.com, and be sure to join us every Thursday here on 6 News at 5:30 to see if we use your question on the air. Kristen.